Thank you for taking the time to join us this morning. It's a great pleasure on the day before the opening of the legislature to discuss the important issue of mental health and substance use disorders. And today it's my honor as the National Board Member of Women in Government, a nonpartisan, nonprofit organization of women legislators across the country, to unveil the Mental Health and Substance Use Disorder Policy Toolkit. And the toolkit has been developed by women legislators and subject matter experts for the past year. It's a guide for policymakers, and it's being unveiled today across the country by women legislators. The purpose of this toolkit is to educate legislators on the issues surrounding mental health and substance abuse. The purpose of the Mental Health and Substance Use Disorder Toolkit is to inform legislators that this problem needs to be all-encompassing. It needs to address issues of access to coordinated care, housing, training professionals, the judicial system, recovery, and data collection. One of the main focuses for many women in our Women's Caucus is the growing epidemic of substance abuse related to opioids. Opioid abuse is a serious issue that is plaguing millions of Americans. It's estimated that 2.1 million Americans suffer from substance abuse disorders related to prescription opioids. The results of this growing opioid epidemic have been, to this point, catastrophic, and the number of Americans who develop a dependency on opioids has more than quadrupled since 1999. Overdoses as a result of opioid use are growing at an unprecedented rate, and overdosage is now the #1 leading cause of accidental death in the United States. In 2015, the total number of drug overdoses nationwide were 55,000, and of that 55,000, 33,000 were related to opioids. According to the Hawai'i State Department of Health, opioid pain relievers contributed to more than 1/3 of the drug overdose deaths in the state of Hawaii from 2010 to 2014. As we can see, given these staggering statistics, the opioid epidemic is one that threatens our community and our loved ones. And now I'll turn it over to Senator Roz Baker, who's going to talk about some opioid legislation coming up this year.
I'm delighted to be part of this Women in Government initiative. You know, last year we passed the naloxone bill, which is an opioid antagonist. So if somebody is in the throes of overdosing, they get the shot of naloxone and their lives are saved. But that doesn't really get to the root cause of the epidemic that we have. So this year, in consultation with the Kaiser Foundation, Pew Charities, we've looked at some of the best practices, and we'll be introducing in both the Senate and the House a bill that does two things. It's an omnibus bill. It would establish an informed consent, so that if your prescriber is prescribing opioids, or there's another one that's not an opioid, but it's a very addictive as well, and it starts with the letter B, and benzodiazepine. Thank you. So what would happen is the prescribing physician needs to present all of the information to the person getting the prescription to understand the addictive nature, how not to abuse it. They must really be doing an in-depth history of the patient to know whether they might be likely to abuse and become addicted to it, and that an addiction can cause death. So it's really important that we have this interaction between prescribing physician or provider and patient. The other piece is to make sure that we don't have physicians providing too many pills at the initial prescription. So along with informed consent would be a requirement that first prescription can only be 7 days. That makes sure that the physician has an opportunity, or the primary care provider has an opportunity to bring that patient back and discuss with them what the reactions, how's it going, and just do a double check to make sure that they're not on that path to addiction. So we're hopeful that this measure Some folks think the informed consent might be too controversial, but you've got to start having that discussion in our community. We have to stop the overprescription and the opioid and other controlled substance abuse in our community. The other bill just deals with the 7-day prescription. So if we're not able to get the entire package, we have one that could go on its own. And I think either one of these, both of them will really make a huge difference. But if the legislature determines that just the 7-day is the best that they can start out with, and we have more discussion with providers on the informed consent, I think we will be going a far piece down the road to make sure that we can halt the opioid and substance overdose and abuse in our community. Thank you so much.
Aloha. I want to thank all of you for being here, and I want to thank my colleagues. This is legislation that we have been looking at and working on this issue actually for several years. It's gratifying to me that we can offer this legislation and that we'll be able to discuss it and with the leadership of the women in the House. Senator Baker summed it up. We have active participants in the community, doctors, groups working with substance abuse, working with us on this legislation. So I'm looking forward to the work ahead. Thank you.
At this time, if there's any questions, we will take questions.
Are there any differences between the urban areas and the rural areas in terms of substance abuse and doctors prescribing? Is there a doctor shortage?
I'm told that narcotics enforcement and even some in the medical community know who the overprescribers are. And I think by really shining a light on limiting, in terms of time, the amount that the first prescription can be written for, that it's going to really help. And so what we're also trying to do is raise awareness in the community. Raise awareness among pharmacists, raise awareness among physicians and APRNs who also have prescriptive authority, that we really need to take a really hard look at how we are helping people deal with chronic pain. We're going to be looking at increasing the amount of days that one can use acupuncture. Those limits haven't been increased in a while. That's going to be another mechanism that people can use to deal with chronic pain. So I think we're trying to look at it while we're honing in on opioid and controlled prescription substance abuse. I think we're also going to be trying to look at it a little bit more holistically.
How does it look in the House and how does it look in the Senate in terms of passing? Have you polled anyone? No?
We haven't polled anyone yet. We haven't introduced the bill yet. But again, I'll say this. Over the last 2 to 3 years, we've had various measures concerning opioid abuse come up. And I think the time is right. Again, we did pass 2 bills last year without a whole lot of focus and attention, media attention on it. So I think now that we are honing in on it, and we have both bills that will be introduced in the House and the Senate, we have those bills also being considered to be part of the Women's Legislative Caucus package. So they very well likely will end up there. That there will be some activity in both chambers.
You know, I think one of the things you're going to find for these pieces of legislation is that it's going to be broad area of support from the Department of Health, from the folks with Native Hawaiian Health, Women's Caucus, community health centers, our emergency rooms, the emergency docs. Anybody that sees this knows that we've got to do something with it. And I know that the doctor in the Senate is going to be supporting these measures and helping us out. And he, in his previous tenure as Senate Health Chair, helped to lay the groundwork for some of this. So I'm looking at the opportunity of a real grassroots and broad spectrum of support. I'm not expecting a lot of opposition. There may be some tweaking around the informed consent, but I don't think anybody's going to fight the effort of really wanting to get a handle on this issue.
So no specific ethnic group, no specific age group, it's everybody?
Oh, it's an equal opportunity disorder.
must say, I think it is very equal opportunity, and we're concerned about kupuna, who are addicted to these kinds of pain medications that they get, and they're overprescribed. So it's really it's really a broad-based kind of initiative.
If there are no other questions, I just want to close by saying, as you can see today, there are legislators across the nation and within our Hawai'i State Legislature that are realizing the severity of this problem and that it needs to be addressed because it is an issue that affects each and every one of us. So thank you so much for coming out today.
Wow.